Hi, Heather here. I'm here at the Chota Rec Center. We were going to go live, but I'm not a camera person, so I am going to splice this into the video recording of our session today regarding physical therapy that Covenant Health has been kind enough to provide the education and resources for. But first thing I wanted to do is introduce myself. My name is Heather Micah. I have lived in Tellico Village for 3 years. I moved here from Knoxville, although I'm not originally from Knoxville. I absolutely love Tellico Village. Anybody who knows me knows that, but I'm involved in everything. I own Citizens Insurance Solutions. We represent all insurance companies, health and life insurance across the country, all insurance options in health and life insurance. So anytime you know someone that we can help, we'd be glad to give you a thank you if we can sell them insurance by making a donation to the charity of your choice. No matter what state they live in, we can help them. And I think that was the most important thing that I needed to say. The reason why I'm doing this and bringing Covenant was on board with this is I absolutely want to raise the health and awareness of our community and increase our self-care. And I think I said earlier when I was in front of the group and forgot to record that if I was Bill Gates, I would have a wellness center here at Tellico Village that literally was in every component of healthcare we wish that we had, that insurance won't pay for. So this is my best effort at doing that without being Bill Gates. So thank you and enjoy our show.
I've been out about 31-ish years and is 26 years in collectively with our staff. We have 5 physical therapists, 1 physical therapy assistant, an occupational therapist, and a speech therapist. And collectively, we all bring about 200 years experience to the table for our therapy center alone. So, and I really appreciate what you're saying. You know, for us, you're in a place where in healthcare is more challenging now than it has ever been. I am with the years I've been out, I have watched it. When I interviewed for PT school, and they're like, well, why do you want to do this? And one of my answers was because it's an ever-evolving, changing field where I will continuously be able to learn. Never did I dream what I would be learning in the 31 years I've been. And it has changed more rapidly in the last 2 or 3 than it has really almost my whole career for it. So, you know, some of the things that I hope that you can extrapolate from us today is, what does that forefront look like? The greatest challenge I think I see with patients coming to us currently is there's always questions about insurance. There's so many insurances out there now. How does that fit into what rehab is? What will it cover? How can I even get in your doors? Those rules have changed as well now too. Physical therapy has evolved, and it's true for all of our services. Physical therapy has evolved over time so that now you can self-refer yourself to our services. Sometimes what happens is depending on what type of insurance you have, if you have Medicare requires that your physician sign our plan of care, but your physician doesn't have to provide that referral. And that's true for whether it's PT, OT, or speech. You can call, you can ask, we can evaluate you. What we will do is send that to a physician. Just say, this is your patient, they've asked to receive our services for what it is. I will tell you, there's maybe 2 physicians I have ever had that came back and said, well, I want to see him first. Most of the time the physicians are happy that you're engaging in your own health because you know what you need, and it helps eliminate some of the bog down that even they're getting, because we're just getting, it's harder and harder, even for your primary care. You call and say, hey, I'd like to make an appointment. Great, we'll see you in 4 weeks. For my primary care. So that's one of the things you can do that's much easier to access our services. And that's true no matter where you go, because at the end of the day, healthcare is about choice. And one of the things that I think sets us apart and makes us unique is we are afforded the time to spend with you as a patient. Oftentimes in today's world, you try to sit down with your primary care, or if you go to a specialist of any sorts, you know, most of the time now you're seeing that mid-level provider. You've got to go through the stages before you really even get to see the physician for what it is. So we're afforded more time to sit and be able to have that history, see what's going on, and we can communicate that back to your physician oftentimes if you feel like you've been shorted in what that time is. So that's a little bit about how you can actually get in to see us. In our clinic, like I said, we have occupational, we have physical, and we have speech therapy services. Sorry, I lost my train of thought on what that one was. But you can, for our physical, we do orthopedic care, we do neurological care. That's why I wanted to bring Ann today too. She is, with the certifications, I'm McKinsey certified, so my specialty tends to be in spine care for what it is. McKinsey also includes any extremity stuff you've got going on as well. We have therapists that are trained in ASTEM or SASTEM, which is a type of deep soft tissue mobilization that you can do for people that suffer with orthopedic injuries. We have, Ann has the neurological background of being certified in POWER, as well as in BIG, which is for, it was designed primarily for people that suffer with Parkinson's type of issues. My speech therapist is Loud certified, so BIG and Loud was one of the first programs that really started coming around for people that suffer with Parkinson's. But when you're there, you'll see with a lot of the treatments that a lot of things really overlap for what they do, whether it's for the orthopedic side or the neurological side. The other thing is, and we're seeing more and more and more and more since COVID has actually hit, strokes. You know, it used to be, even 5 years ago, strokes was more seen in the population, 6th, 7th, 8th decade of life. Strokes are no longer a respecter of, you see it kind of in an older population. We see them 20s, 30s, 40s. Why? Nobody knows how they kind of put a stamp to what that is, but I will tell you, since COVID has come along, a lot of that has really changed. See a lot of people that still are, have post-COVID symptoms, where they just still are very weak, maybe easily short of breath. So we're treating a lot of those folks as well. So that's what, you know, what we really are. We're orthopedic based, we're neurological based for what it is. We pretty much cover everything. My speech therapist also does vital stem, which is a treatment you can do for people that have suffered with sometimes cancer, or they've had certain types of diagnoses where they have difficulty being able to swallow. It's a treatment that you can do that will help improve swallowing for what it is. We are unique in this area is that we're one of the few that actually give you a full comprehensive service. So if you're coming for a stroke and you need all 3 disciplines, you can schedule at one place versus having to be, you know, at one clinic for one thing and another clinic for another thing for what it is. Does anybody have any specific questions related about what, does anybody have anything specific related to a question for PT for what it is? Anybody had physical therapy in this room? 1, 2, 3, 4. Huh? Yeah, exactly. So, you know, so what I want you to know is you absolutely have a choice of where you get to go for what your services are. We are really, really rich in what our education is and what we have to offer for what patients are. I will tell you the greatest thing about working for Covenant, again, is it gives us that time afforded that we need to spend with you for what it is. And they are, we are so focused on patient first. So they put behind us opportunities for education so that we can grow our skills, because part of that being patient first is that we're able to provide and give that back to you as well.
When you all have had therapy in the past, was it just you one-on-one with your therapist, or were you there with 4 other people and you felt like the therapist was like splitting their time?
I had
splitting time.
Yeah. So one thing that's really great about our clinic is you get one-on-one direct care with your therapist the whole time you're there. We don't use texts. So if you're there for an hour, you're spending an hour with Pam or myself or one of the other therapists. So I think that's really special and unique for us. Yes, sir.
I don't mean for this to sound cynical, because it's not.
Sure.
What is the what is the overall success rate with, let's say, physical therapy for people that come in, back hurts, shoulder hurts, whatever, and they come in for treatment? Not everybody is cured, and I don't care what area of medical science it is. Is there a pretty good percentage of success, or is it?
So here's how I would answer that. It depends on how you define success. So when people come in to me and, they want to bring imaging, x-ray, MRIs, this is what my doctor says is my problem for what it is. I've got severe stenosis, spondylosis, whatever name you want to put to what your pain is for that moment of time. So part of what we're always going to do, because we have a lot of people that want us to kind of give them drive-by advice. It's hard to give drive-by advice because I want to see you. When I'm giving you information about what your pain is, I got to see how your pain behaves, which means I'm going to take you through a full evaluation for what it is. Based on those findings, that's how we will establish those as goals. What's important to you? Are you looking for complete pain abolishment? If you're in your 5th, 6th, 7th decade of life, and your imaging doesn't look all that great for what it is, I'm probably going to look at you and say, I'm not here to make you pain free, but I am here to teach you ways to help reduce your pain. I'm here to teach you how to manage what your symptoms are and to help give you guidelines of how do you manage this for what it is? When do you want to see a practitioner, i.e. see a specialist, ortho, neuro, something along those lines. I'm a big believer that people come in and they'll say, here's my MRI, here's my x-ray, and I'll say, okay, then I'll set it down, turn it flip side down, because that doesn't really tell me anything. What tells me is when I have that opportunity to have that one-on-one time to you to see how you respond. Because if you look at what research says every one of us, are going to show some degree of change in your bodies when you look at imaging for what it is. But just because you have an image doesn't tell you what the pain is. There's too many things that can generate pain, too many types of structures that the body has that can generate pain. So, if you've been in your normal state of life, everything you do, and 2 weeks ago you woke up and you had back pain because you were either in your yard and doing activities, you were out on the tennis court, you were out on the pickleball court, you were on the boat and you hit a big wave, you went and saw your doctor and they ran this x-ray and they said, oh, here's your problem, you've got arthritis in your back. Well, you didn't have arthritis pain 2 weeks ago, But if you come to me and you say, man, it's been killing me it's been hurting for at least 2 years, maybe even 5. It's just that I went out and started doing some yard activities and it got worse. 2 completely different scenarios, but your imaging didn't change for what it is. So my goal, if you're coming in and saying, this came about 2 weeks ago, but before I wasn't having any pain and living my normal state, that imaging really doesn't say much to me. My goal is to get you back then. So when you say, and I don't think that's a cynical question at all, I think that's an excellent question. Because that's part of when I say we're afforded that time, that's the time we're afforded. We're afforded that opportunity to sit and really do a very thorough exam. The other thing that's unique from us than you get from a lot of healthcare providers, we get to see you over a period of time. I'm not seeing you just once, maybe once a year, or saying, come back in 3 months or 6 months and we'll check what your blood work is. We're there to develop a relationship with you. And in that relationship, we get to do a lot of education and teach you things, sometimes things you may have heard, sometimes things you haven't. Again, kind of going back to your question of how you define that success. For an aging population, people that suffer, especially if you're active, you live out in the village and you're playing pickleball or tennis, I expect that you're probably going to come in to us and say, I've strained my shoulder, I've strained my back, my knee, my ankle. You may come back and we get you better, and then you get back out there, start playing again, and 6 months later, it comes right back again. So, you know, the business that we're in, we're here to treat when things kind of start to fall apart and teach you how to manage those things that hopefully keep you away from healthcare providers, whether it's us or somebody else, for longer periods of time. But it is just an ongoing revolution. It has the potential to be an ongoing revolution, you know, to provide care for you. So does that kind of answer your question as to?
It does. I mean, there are different areas in medicine in general that right up front, it's like, this has a certain percentage of success. You appear to be someone that this may positively benefit, or this is kind of a crapshoot. Let's give this a try and see what happens, and we'll go from there.
Yeah.
And so, you know, some people are gonna go in and say, wow, you know, this is really a successful area of medical science, and some people are gonna say, well, that was a waste of time and money, and,
The fantastic part about all of this is there's so much more research happening now. 30 years ago, physical therapy wasn't researched. And so now you're seeing the benefit of all this research because we're proving that exercise is beneficial not just to your musculoskeletal system, but to your nervous system. And they're looking at all of those things. And so being active is actually the fountain of youth. You know, everybody wants to stay young, and so the healthier you are, the more active you are, the better you are, the sharper your brain is. And so it's more about what's your function versus what's your pain. Because we're all gonna hurt at some point in time. We've all gotten hurt. That's pain, but we wanna work on function. If we can get you stronger, the pain gets better. I'm sorry, I didn't mean to interrupt you. Had a
Oh,
question.
no, and I'm his wife, so I'm entitled to say, the MRI isn't going to change, and the results of the MRI is not going to change, but you've seen me in physical therapy going from not being able to walk. It's not going to eradicate all of my pain because my pain comes from different sources, but I can do things that make me stronger after physical therapy, and I'm going to feel better. So, does that help answer your question?
thank you.
Well, and is it, I always think of, in my mind, I've had physical therapy several times. I have lots of, I look young and healthy and 20, of course, but I'm not. And I have all the ailments you could possibly imagine. And I've done physical therapy many times, and I feel like it reminds me of church. Like, if I just do it an hour or 2 hours a week, no, or my spirituality, let's put it, my practice, right? But it's my homework and the stuff that I put into it. And you know, she mentioned the group setting where the therapist gets 4 people started or 6 and walks away. Even though I want to get better, I literally, when they're not watching me, I cheat. Why, I don't know. I'm cheating myself, I know that, but I can't help it, it's hard. And I don't want it if they're not watching me. So I just feel like there's a lot of component of, with any part of medicine, your own, what you do behind closed doors and your own, what you put into it.
There's that piece of personal accountability.
Yeah, 1000% agree. I mean, so when you come into physical therapy, you will get a home program. And you should get a home program. I don't care what clinic you go to, who you see, for what it is. There is a component, because we can't be with you 24/7. We can get most people truly feeling better. There's those handful that they may need more, i.e., if you're coming in and you have back pain and your physician looks at you and says, and sometimes insurances are driving this now too. Doc says to you, well, I can't image you, or I can't do anything until you've had 6 visits of physical therapy or more. And so when we provide those programs, the importance is that it's like you getting an anti-inflammatory or you getting a pain medication. That's how you should really look at what your exercises are. We're going to look at you and give you a frequency and duration. I need you doing these 2 times a day or 3 times a day, depending on what that condition is. So that's
How many people take medicine? How many people take medicine? Right? So exercise becomes a prescription. If you go to the doctor, you want to feel better, you want your blood pressure to be lower, exercise becomes a prescription for your health.
And you know how easily we all adopt.
And it's,
our
it is
prescriptions.
hard, you know, it's hard to be disciplined to do that. And so a lot of times, we're there to help build that habit. You know, there's habits you have good habits and bad habits, right? And so we wanna encourage the good habits, we wanna like foster that, and that's what we're trying to help with also. So it's a team effort, and I think that's what makes physical therapy and occupational therapy and speech therapy, those therapy parts, like beneficial. And you know, a lot of people have questions like, what's the difference between physical therapy and occupational therapy? We have a lot of crossover. Occupational therapy looks at more function and home, activities of daily living. If you've had an amputation, how can you modify your house so that you can still cook for yourself, still bathe for yourself? Because there's a big push to age at home, right? We don't want to stay where we know and with our friends. That's
Yeah,
important.
my question was mostly because I never had physical therapy and had a very physical line of work my entire career. And I thought, I was still in my 60s and thought I was not gonna live forever, but I'd still live happily ever after. And now I'm in my 70s and a little lower back pain. So she had some serious conditions that occurred a number of years ago, and the difference between then and now is night and day. So obviously it does work. I've not had to try it, so.
And I think, and when you say work, I think there, you know, it's what the benefit of what the service is that you're receiving for what it is. Because the reality is, like you said, you hit kind of that 7th decade and now you feel the decline. And that happens at various forms throughout anybody's age. I mean, you could be in your 40s and you start to feel bad. And there's other comorbidities that exist around that. If you have any other disease processes, diabetes, other those things, you know, what typically happens is we want to manage our health when our health goes bad. We want to teach you how to manage your health either before it gets worse, you know, so that you have the capacity to continue to go as long, and that's true of my 15 or 16-year-olds that want to come in because they've been on the soccer field and they sprained the ankle, or, you know, even to my folks that may live in the retirement community and they're out on the pickleball field, or they've, you know, the worst ones that we see are the ones that you're in your normal state of life, and then you walk in one day and your face feels a little tingly and your arm feels a little tingly, and you go to fix a drink and you can't raise your arm, or your leg starts to feel weak. Nobody plans on those things. And strokes are so critical. They will take you out fast. And it is, you know, we say time is brain when it comes to strokes. And if you feel symptoms, there's an acronym that we use that's called Be Fast. And that acronym is so important because the quicker you can get to medical care, you've got a much greater chance of being able to stop or resolve that stroke without really having some of the devastating effects that, you know, that can come as a result of what that is. If you want to put 2 cents in on what that is, because you see a lot of our strokes.
Well, I had a question, not about strokes, but just a question about the self-referral process.
Okay.
How do you know when it's appropriate to self-refer for physical therapy versus massage therapy versus chiropractic care or something like that?
And I think that's a great question.
That is a great question. Thank you for asking that. That's a great
Yeah,
question.
you know, I would tell you, there's not just, I don't have just just an all-out answer to it, especially with those disciplines, because those particular disciplines have the ability to kind of cross over. You know, most of the questions I'll get is, when do I self-refer to you or massage or chiropractic over versus when do I go see my doctor for what it is. Here's what I would tell you that PT separates, or what rehab services separate from massage therapy. What our background and our expertise is in, you know, we get a lot of education in pathological stuff. Massage therapy doesn't really get that on the pathological side. If it's something that, if you feel like you've just really strained it because you've been out on the pickleball court or tennis, or you've walked, or you just got back from international travels and you sat and walked for a lot. If it's something that's really acute, you've not had a fall or something that would make you think you have a more sinister condition, then massage therapy is always an alternative. Huge proponent of massage therapy because it is soft tissue mobilization and manipulation. And the whole intent of that, increase blood flow to the area, try to get the muscles to relax and calm down. And once you do that, oftentimes you will feel these residual pains start to kind of ease. So if it's really acute, you've utilized massage therapy in the past, I wouldn't discourage that. If you had a fall, if you had some reason to believe there's something a little bit more wrong other than you just strained the muscle, what PT is going to afford you is a full eval. Ann and I were talking on the way over here about a patient she had who actually was referred to us by his practitioner, and worked with him for a short period of time, and she's like, you know, things just aren't adding up. You know, how your pain's behaving, how you're functioning, I'm not good with this. Sends him back to the practitioner and says, go back, talk to him about maybe trying to get an x-ray. And the practitioner came and actually sat her down and said, hey man, I just want to let you know that's a good catch. She's like, okay. And he said, he actually has a fracture. It's a very small fracture. It would have been hard to perceive, but if you'd gone just massage therapy, they truly don't have the skill base to look at you and say, you need to be going back to your doctor because that's not really adding up. Part of what affords us that too is kind of how we see you. With massage therapy, you might schedule them for like once a week, or you know, once every couple of weeks. Whereas with us, you're going to be seeing, most people on average, I would say, see us 2 times a week, sometimes 3, sometimes 4, depending on what we may want to be seeing you for. So that's what this differentiates us a little bit on that side of what it is. As far as chiropractic, there is some overlay between what PT and chiropractic is for it. You know, if you have a chiropractor and that's there, you have good practitioners. I don't care what field it is. You've got people that are really good at what they do, and you've got people that are so-so at what they do. It's truly the passion of what they do to educate themselves and to pull that in. If you've got a chiropractor at somebody that you work with, see them. You know, explain what the issue is to them for what it is. With PT, our goal is to really teach you. We don't want you dependent on what our care is. I want to look at you on day one. You come in, I evaluate you and say, on average, most people with the type of condition you're presenting with, they're going to be better 6, 10, 12 visits. And then you're good to go until things kind of start to fall apart again. Chiropractic care follows a little bit different model. A lot of times what they'll do is they'll have you come over and over and over and over and over and over. Not good, not bad. It's just whatever you feel like is giving you the best results or the best success for what you're feeling. That's a little bit of the difference of what you'll see between those fields. As far as education, chiropractic, PT are very close hand in hand. I will say for chiropractic, one thing chiropractic has probably over us a little bit is nutrition. They're very heavy in their education with that nutritional component to what it is sometimes. Whereas for us, we're very heavy into, like I said, that assessment, what tissues are affected with it, how we get that better with activity and exercise.
We get more medical training for differential diagnosis, so you know, if you come in and you're complaining of dizziness or vertigo symptoms, and we're gonna look at your blood pressure and everything else in your medical history, and if you don't kind of tick off some boxes that show it's actually a physical dysfunction, we're gonna send you back to the doctor or encourage you to go to your doctor, because that dizziness could be your heart, it could be something else, back pain could be your kidney function. So, and the other side too is we're covered by your insurance, so you know, we are medically trained, so there's that component too.
Absolutely. We'll go here and then we'll go there.
Does Tennessee allow direct access? And if they do allow it, how many treatments do they allow that the insurance company will color before they say doctor.
Yes, Tennessee, absolutely, we are full direct access for what it is. What sometimes affects that, and that's what we refer to as that self-referral, what sometimes can affect that, there are certain insurances, like if you have Humana Gold, Humana Gold requires that we have a physician order. So you can still self-refer, and when you try to set up an appointment, they're always gonna say, who's your insurance with? And so we pretty much know, for the most part, we pretty much know who's got to have that physician order for what it is. Humana Golds, some of your Advantage plans do. United Healthcare Advantage, I do not think you have to have that physician order. Right now, Humana Gold's the only one I can think of.
Blue doesn't make you do it, Blue?
They require you to have pre-certification, which means that they require a physician order for that pre-certification. Humana Gold does.
What about Blue though, don't they?
The UHCs, then the Blue, now Blue Care, certain, the Blue, Advantage plans, I
They
do
don't?
not think
Okay, good,
do.
because that's what, they wouldn't need to know about the Blue Care thing.
Yeah, and that's why I was saying with those, but when you call, who are our office coordinators, we've got two, we actually have two clinics. One is in Lenore City, one's on this side of Loudon off of Grove Street. The Grove Street location, we do just the physical therapy services, and then, at our Lenore City clinic, we do all. But both of our office coordinators are trained in that, so when you call, they'll tell you. You know, with Medicare, like I said, with Medicare, you do not have to have the physician referral. What Medicare says is we have to get that plan of care signed. So if you self-refer, we do the evaluation, we send that to your physician. So a lot of times we'll say, you might just want to give them a heads up that this is coming, say, just call the nurse and say, hey, I just want to let y'all know I'm referring myself to therapy. I'm going to get an idea of what's going to help me or not help me. And if we, you know, my rule of thumb with my patients is if you're self-referring to me, I'm going to see you for 4 to 6 visits. If you're not changing or getting better in 4 to 6 visits, we're not gonna keep going down the rabbit hole thinking, oh, well, this is gonna help, or this is gonna help, or this is gonna help. I'm gonna be looking at you and saying, let's get you back to your primary care. Let's get more information with what's going on here for what's happening with it. As far as number of visits, unless your insurance limits that, your number of visits for our services is based on what you need. If I can get you better, some things I can get you better in 4 visits. Some things it might take us 14 visits. It's not uncommon sometimes that you might need 24 visits for something. So as long as you don't have limitations on that insurance side, under direct access in Tennessee, we can see you for 90 days as long as you're continuing to make progress. At the end of 90 days, if you're making progress and you still need more, we're gonna go back to whoever you tell us to contact, whether it's your primary. I mean, there are some people who I get that, they have a direct line to their orthopedic office or to their neurosurgeon's office, and, you know, they'll just call and say, hey, send an order over to therapy for me for what it is. But that is our actual rules, 90 days as long as you're making progress. If you're not showing progress within 30 days, we have to send you back to the physician. If you're seeing me or any of the folks in my clinic, we're not gonna see you that long. If you're not making progress within 4 to 6 visits, we're gonna have that conversation that says, no, this isn't typical for what we would expect for what you're doing, so we're gonna get you back for what it is.
Hey Pam, while we're on this subject, I know we have another question,
Yep.
and we're gonna get that, but just while we're on the subject, I forgot to mention that in your folders, I put couple little factoids underneath the speakers today and what we were talking about. But if you know anybody, I'm not sure if this might apply to you, it might not, but I wanted to let you know that the marketplace plans, or people who are having health insurance through the marketplace, or whatever you want to call it these days, healthcare.gov, or Affordable Care Act compliant plans, every single plan limits therapy to 20 visits a year. And let me tell you this, I had a situation where they had a knee replacement, they got their 20 visits, because for the Obamacare plans that I know about, that I always tell everybody that any service that's going to be prolonged or expensive, they want to do prior authorizations. That's typically the case. and they got the authorization for therapy and the knee replacement, no problem. Then they wanted to do the second knee in the same year, and they got the authorization for the knee, but guess what? After they're out of surgery and they're going to get therapy, they just find out that there's only 20 visits, and then they had to pay for their own physical therapy because, you know, they used the 20 visits. So I just wanted to mention that because I wanted to, that was something very important about insurance and this topic that I wanted to
Yes.
convey to you. So thank you for letting me interrupt you.
No, and that's why I'm glad that you actually raised that question, because those are two really self-referral, direct access is, it's new to us in the sense of, we finally feel like we have an even playing field with, you know, with people. Our educational background, we should have had direct access long ago. What direct access affords, it feeds into the Affordable Health Care Act, because now you're not having to pay a $30 or a $50 or a $75 copay just to get a piece of paper to walk in and say, I want to receive physical therapy services, particularly if you already know you want to receive physical therapy services. You know, half the people in here raise their hands and I've had it in the past. Probably at some point again, you're gonna do something, you're gonna tweak something, something's gonna happen where you're gonna say, oh, I can just run and get some physical therapy, particularly over taking anti-inflammatory drugs or prednisone or pain medication and, you know, all the things that there's the warning signs that come with it in today's world. You know, we're drug-free for what we do. We do modalities sometimes, we do ultrasound. One of the big thing, and if some people here may have a question over it if you don't, but dry needling. That's the new thing that's kind of on the front of what physical therapy is. We have 2 practitioners in my clinic that will do dry needling. It's not for everybody for what it is. Unfortunately, it's a service that is not covered by any insurance, but we have tried to keep it to where we really have the lowest cost of anybody that's doing the dry needling service. And again, it's one of those, you might do it 2 or 3 times. I personally see excellent results with doing dry needling. But if you do it 1 or 2 times, if I'm not getting the results that you and I both are looking for with it, there's lots of other ways that we can kind of skin that cat for what it is. So, your question.
Yes, actually, a lot of it's been covered here. I'm not sure how my specific situation ties into it. I first went because of a safety issue and decided that came on. Well, after a few years, but it really got bad. And this is 2 months ago, 12th of May. And I thought it was strange. He didn't refer me, he said you could go anywhere.
Yep.
Maybe it's because I'm 83 and therefore qualified for Medicare, right? And I also have medical. I'm retired from the military. So
Oh, yeah.
Thank you for your service.
Yeah.
So is there a limit? Because I've been going for 8 weeks now.
Okay.
And it really helps the sciatic nerve, but it hasn't completely taken care of it.
Yep.
I went out and cleaned my driveway for a long time, a couple of days ago, and the next day it was bad shape. But I think that happens when you're in the mid-80s, maybe. But give it a break. It seems like the more that I do, the worse it gets, and I'm really comfortable sitting here, you know, if I do a lot of work. The question is there a limit? Because I've been going for 3 days a week, 8 weeks, got better, only got worse, only because I think I aggravated. But I sense that it's not gonna get any better than it is, though my first fellow that I saw, the orthopedic surgeon, I thought he probably wanted to cut me up real quick. He
Yeah.
said, no, he said, you don't have a problem, based on the imaging. And he said, just go anywhere and it'll work. Is there a limit in terms of insurance in my situation, you know?
And you said you have VA for what it is?
Do you have
I don't
traditional
do the,
Medicare?
I don't do the VA.
Do you have
Do
traditional
you have TRICARE for life?
TRICARE for life?
TRICARE for life.
TRICARE for life.
And traditional Medicare?
Yeah.
Or another
Uh,
Medicare
You
supplemental?
don't need that with TRICARE for life.
Yeah.
But do you have original Medicare A and B though, and your TRICARE? Cause some people don't take the B, and physical therapy is covered under B, and you don't necessarily quote unquote have to take Part B with TRICARE for life, but I always recommend it for various reasons, this being one of them. So it depends, do you have A and B and TRICARE? I can answer this if you'd like.
Well, there's a different rabbit hole I'm gonna take you down on that question, because number one, everybody has a choice, but you have a choice because that's the law. You know, you do have some practices that will wanna say, I've seen some physicians, patient comes out, they've had a hip, a wrist, or whatever. I need you to see my therapy because I control my therapy. The law says you go wherever you go. I would encourage people, what I tell my patients is, you're developing a relationship with us. You know, you should feel like you could come to me and say, hey Pam, I've been here 6 weeks, I'm coming 3 days a week, I've got an X amount of copay, or I don't. This thing ain't changing. What's going on here? What do we need to talk about with it? So your question to me is do I have a limit on what that is? I would be having a conversation with you that says, if it's not responding to what it is, you and I are gonna be looking at, well, maybe it's coming from something else. Is this coming from a lumbar spine? Is it a foot? Is it an ankle that's causing more problems at the hip? So if you're doing the same thing over and over and you're not getting the results for what it is, I would question whether you really just need to keep coming to see us anyway if you're really not changing
I'm
for
wondering
that.
if the orthopedic surgeon misspoke in that he said, yeah, you go to physical therapy and they can eliminate that sciatica and hip problem.
Yeah.
It hasn't been eliminated, and I'm just wondering, do I just continue with the hope after 8 weeks or not?
Yeah, I mean, so when you look at what we call sciatica is really a symptom, it's really not a diagnosis. You know, if you're having sciatica, there's something else that's causing and contributing that pain. Is it a nerve root that you're getting compression for in the lumbar spine for what it is? Or, like I said, is it bad biomechanics when you're walking and things are changing because you're just really weak that's there?
Is it a tendinopathy?
It could be a tendinopathy that you have there. If you're not seeing those results, alternatives are going back to the ortho guy. If you really liked your ortho guy, you can always get a second opinion on the ortho side. I'm just not seeing it. What I usually encourage, because most people who they really develop that relationship with too, most, not always, is your primary cares. You know, your primary care is gonna know everything. Sometimes people come to us and, well, give me your history, and we dig as deep as we can, and I'll get 3 4 weeks into treatment, and they'll say, oh, did I tell you about that fall or that motor vehicle accident that I had, you know, a year ago or 3 years ago? No. Oh yeah, I fractured my ankle, and then my gait got all wonky after that, and, you know, I'm like, okay, well, let's go back and let's revisit some of these things that are there. So if you're not seeing results,
Well, in my case, it's 70% better. I've got
70?
another 30% that's hanging in there.
So that 30% might be something different.
yeah,
So you might want to have a conversation with your therapist.
yes,
Say,
that's
hey,
what I was gonna say.
you know what, I'm 70% better from the first day I walked in here,
Yes,
but now when I go do this, I feel like it's coming back, but if I rest a little bit, it gets better. To answer your question, TRICARE doesn't limit. Traditional Medicare gives you a dollar amount. Some of the other insurance plans limit your number of visits. With traditional Medicare, if it is medically necessary, it's been proven that you need the skill of a physical therapist, they allow maintenance. So for those neurological disease processes that we know aren't gonna get better, for example, Parkinson's, which is the fastest growing diagnosis in America and the world, that's a neurodegenerative disorder. People can see a physical therapist forever. So it truly is it depends on you, and it depends on you, and it depends on you. And thank you for your service, and thank you for your service.
Well, and two, in a way, I'm not saying this is what he was hung up on, but I know if I heard that from my doctor and it wasn't eliminated, that would be my expectation, that it was gonna get eliminated. So I would be
Yes.
disappointed with 30%, whereas if you knew it was
Yes.
something you had to live with forever, you'd be and I'm not saying this against you, but I know me personally, I'd be thrilled with, I'm 30, you know, I only have 30% left of what I had
Yes.
before. So it kinda a little bit has to do with that, maybe.
Maybe you're assuming these doctors know everything.
Yeah, I know.
No,
That's a good point.
I 1000% agree, and that's why words really are so important. Because like you said, you're seeing a physician who says elimination, and then you're coming to therapy. And so part of my thing too would be going back, like what, you know, when I answered, what is your name, sir? Tom. When I answered Tom's question about success, you know, what is success, for what it is? Are you acute? I mean, did this just, you said May, so prior to May, having zero pain, or you've had this before, it's just got worse and it won't go away?
No, I've had it, and it just over a couple of years, it got worse. And
Yes.
if I drive in the car, my
Yes.
leg just,
I would never look at somebody and say, if you're coming in to say to me, I've had this thing for years, it's just getting worse, to tell you that I'm going to completely eliminate your pain, if it happens, it's bonus points for me, and it's bonus points for you. But when you've dealt with it for years and years, and that goes back to just like you were saying, 70%, but I try to kind of establish that on day one, what really is realistic for this. Is it realistic for me to completely eliminate it? Possibly, probably not. But if I can get you to that 75, I'm probably gonna shoot a little higher. I'm gonna say, I wanna get you at 85% of normal function for what it is. That's usually my goal to try to get you. But to look at you and say completely eliminate, because you're going to live life. I want to teach you how to continue to be as active and live life. Sometimes that conversation for a lot of people is I'm gonna look at you and say, man, I gotta get you off your butt. You know, the reason that thing will not get better is, and this is what happens, you get caught in the rabbit hole in the abyss.
Mhm.
Oh, it's the hip pain starts, and then I go sit in my recliner, okay, that's better. And then I get up, and then I go try to walk half a mile one day, and it's like, oh my gosh, that thing's killing me. Exercise is the worst thing in the world. I'm gonna sit in my recliner because it feels so much better. And then you start to get more sedentary, more sedentary, more sedentary, and now it's not just this hip, but that ankle's hurting, and my back's getting stiff, and oh my gosh, my neck's starting to hurt too. So part of what we do is try to teach is the benefit of truly staying mobile. Do I just need to teach you stretches? And that goes back to the same conversation, how important that home program is. Home program isn't when you just walk into us, okay, I'm seeing therapy for 8 weeks, and I'm done and I feel great, so I'm throwing that prescription drug out the window. If you want to stay better, you gotta keep doing the things that got you better to stay better. And we really try to reinforce that your home program is a lifestyle change. Your home program isn't just for that moment in time.
how do you feel about taking Tylenol, arthritis that's out there? And
Yep.
that makes me feel good. I'm adverse to taking any pills.
Yep. Yeah, totally agree. That is one of those things I would tell you, talk to especially your primary cares. I think everybody is going to, at some point in time, you're gonna go shoot for some kind of over-the-counter pain reliever to get it. Sometimes you can use them just for the moment of time where things are really worse for what it is. And then you should be able to move away or discontinue from using what that is. When it comes to medications, I'll always tell you, talk to your doctor first. Tylenol is not made for everybody. Advil is not made for everybody, or ibuprofen drugs. Steroids are not made for everybody. I mean, you know, there's different mediums that exist that are out there for what it is. People that are post-op, if you've had a total hip, you've had a total knee, total shoulder, rotator cuff repair, any surgery, you know, it's crazy in today's world. You go get your surgery, they're gonna give you your little bottle of pills, and I see more and more people, they'll come to me and I'm like, so have you started your pain medication? I'm not taking that stuff. Not gonna do it. And I'm like going, okay, so you just had major surgery, I'm supposed to be moving your knee or your leg or your shoulder, and you don't wanna take that stuff. There are reasons they give it to you. So, you know, I will tell you, people that John Wayne, is what I call him, is he your
Rough and tough.
John Wayne this surgery.
what of anyway.
Can you do it? Yes. But they do give it to you for a reason. And the reason is just to help you get over the hump. So that, because our goal, restore everything we can get, and surgeries are painful. And so you need a little something, and that's true of any condition. Sprains, strains, all of us at some point in time. It's just whether that's a safe medication, you know, specifically for you. And there's very few, unless your physician tells you otherwise, there's very few things out there that's meant to be for a lifetime, unless you're taking like thyroid or, you know, you're taking statin, blood pressure. Those things are your true lifetime drugs.
If you were to say to us, I'm taking two of those Tylenol arthritis every day, we would start to be concerned about your liver function, your kidney function, which is why we would say go back to your doctor. If you say, I did the driveway, it started to bother me, I took a Tylenol arthritis, it made the pain better, great.
Right.
It's the frequency and how often you're using the medication. But we don't have one problem, right? You know, you could have multiple problems as we age. We can have sciatic nerve entrapment and tendinopathies and weakness and like, so it starts to layer up. So that's when having a conversation with your physical therapist, your occupational, like whoever you're seeing, talk to them. Because if you feel like, hey, I'm getting better, but I'm still having this one problem, it might be a different issue. And now that we've cleared up one area, we'll be able to see this other area. You know, if you have muscle tightness on top of a fracture, like we were just talking about, this gentleman was really tight. So we were really working on stretching, but the bone pain wasn't changing. Everything else was better. And so let's go back 4 visits, right? So it makes a difference.
Fantastic question.
I have a question
Absolutely.
before we wrap up, because I don't want you to, as soon as she says she's done, run off. I've got a present. I have 2 or 3 or 4, so nobody run off. I just need another minute when they're done. But my question is there physical therapy for bad posture? Because it makes my neck worse, and I've been doing it all my life. And I try to be cognizant of it, but I'm not good at it.
Yeah, absolutely.
There
So here's
because it does cause health problems, even though it sounds silly.
Here's the analogies. They say money is the evilness of all of the world. I would tell you posture is the evilness of every physical ailment that exists.
Yeah, so I've
I almost guarantee you, if you're seeing us for an orthopedic problem, the first thing we're doing is assessing for what posture is. Because, this is what the skill of what physical therapy brings you versus, trainers that are in gyms. You know, everybody has their certification for what they do. What they don't have the background in is, like with posture, how are you gonna really correct that? They know how to help you strengthen your muscles, but do they know how to put you in the proper posture so that you're not continuing to cause problems when you're doing exercises or activities? That's the expertise where we lie. My thing is if you're not using good technique for what you do, you know, kind of why do it? That's not really true, because in my world, when I say to my patients, motion is lotion. Even if you move bad, sometimes that's not the worst thing in the world, because I just want you to move. But posture is literally at the crux of almost every orthopedic condition that exists. I would tell you the same thing with neuro. I don't care what it is. If you've had a stroke, your body changes. So part of your body healing is us teaching you how to sit, whether it's in a chair or even sometimes wheelchairs or whatever. The better you can align things for what they are, then the greater chance you have of things healing and truly going away. Kind of going back to your question, you know, is that something that you've worked on with it? Maybe that's what would be a little bit of the magic, is really teaching you how to have better posture with doing exercise when you're out in the yard working, or if you're just sitting and watching TV with it. That's a fantastic question.
And the other thing we wanted to mention for you all too is that we've started a stroke support group at the hospital that meets the first Wednesday of every month. So if you have friends who have had a stroke, or if you want to share that information, or if you've had a stroke, it's for stroke survivors and their caregivers. because we're learning that being able to talk about what's going on with you is also healing. So it's not just, and it's also healing for the caregivers also. So we're trying to do more outreach in the community to be supportive for everyone.
Well, actually, when I send the follow-up of whatever they want me to send, if anything, I will include the information for the stroke support group and the new diabetes support group that'll be meeting here at the village, okay? So I will include that in your email that says thanks for attending.
And one last thing I'll throw in there, I thought about it, I was circling back to what you had said earlier. You know, when you come see us, another thing that differentiates us a little bit from either chiropractic or even what massage is, the minute you walk in that door, we look at you, we assess you, we say, okay, this is what we think may be going on, or this is what we're gonna try. You go home, you got your exercise you're trying. You walk back in the door the next time, first thing we're gonna ask you is, so how do you respond to those exercises? Because what you do the next visit is going, or how you're responding is gonna determine what we're going to do the next visit. That does separate us a little bit from some of the other people or the competition that's out there. You go to some of the therapy groups just in some of the physicians' offices. It's like you said, here's your clipboard, you're going through, nobody's watching my technique for what I'm doing with it. And
You could be making it worse.
you're gonna do the same thing for the next 6 weeks. Okay, that's great, how are you? I wanna know every visit, how are you? Because am I hitting the mark or am I missing the mark? Again, that goes back to determine how successful can you be. And what's unfortunate in healthcare that we see more and more and more and more is, you know, everything has evolved into a protocol or a computer or whatever. You know, some days I feel like we're just, all we are is robots. You know, you're just data entering, Most of our staff, do we do computer documentation? We have to. Again, I'll go back and say it's the law. But we really try to stay away from this so that we have this. You know, how are you today? Did I mess you up? Did I make you worse? And I'll tell you, there's times, I'll tell you, my intent is to make you worse before you come back. Because sometimes the only way I know how to get you better is to really find out what's making things worse. Mm-hmm. But I will preface that with you. I'm going to say you may. Almost all the times after the first one, you may feel a little worse because I'm going to ask you to do a lot on visit 1. Because if I don't know how your body's responding or behaving, and that's, again, that's like Ann saying, it's true of no matter which discipline you see between us, between PT, OT, or speech. But that is something that's a little unique. I think that our clinics probably, I think that's true of any Covenant Health Therapy Center. We're focused on you. We're focused on that time that we get with you. So.
And that's important because sometimes it seems like when you go to your primary provider, literally the whole time they're doing this in front of the computer.
We are asked to do more with less every year since we've been in this profession. But we didn't get into it because we were worried about, you know, the dollar sign. We do what we do because we love people and we like to see people get better. And that's why we stayed in it. It's a passion.
Same thing holds true for insurance, believe it or not, because it's very annoying. Obviously, you probably experienced it a little, and it's definitely a labor of love and passion because it's a necessary tool that, you know, for a poker chip you need in our healthcare system. We're gonna wrap up, but I wanted to say one thing I forgot to say earlier. Anytime you refer someone to us and we can help them with insurance, we will make a donation to the charity of your choice in your name or give you a nice gift. So just remember, we represent all the companies, all the options for any age across the country. And now it's prize time. We'll check under your chair. If you have a business card taped under your chair, you have won a prize. So raise your hand if you find a business card, and I will give you your fabulous prize.
It paid to sit near the front.
That means you gotta move to look.
They were on the side.
Okay. So you got one of these lifestyle cards where you can, all the area restaurants in the village, you take it, you buy one dinner, you get one free. And there's other restaurants in Knoxville and Maryville that you can try. So there you go. Who else got one? Yay, you can try both. Your native Did anybody else got one? Good job.
One last thing
interested in seeing some success rates of torture, go to their Google reviews. They have consistent 5-star reviews, and it's very helpful to see what other people are saying who are actual patients. And then our second piece of information to take away is we're gonna have our oncology talk in August, and we'll send out all of the information.
Yes, I'll send that in the thank you.
But we're gonna talk about things that you can do before you're diagnosed, and then when you've been diagnosed with cancer. So it's very helpful, but thank you all for coming.
Yes, thank you for your time.
Thank you.
We can stick around if you guys have any
Yeah,
questions.
That's great.
That's why I want to say.
Yes.
And then I was like, well, wait a minute, should I call this person first, or do that, or you can, no.
And I was glad you brought that up, because that was part of one of the things I
You're okay.
wanted
Take your
to
time.
really bring out to the forefront today, because oftentimes when people come in and they get these.
Pam mentioned how
policy
big
accidents and
Yes, ma'am.
So now, Parkinson's wellness recovery.
but it also has